We present orthopedic operations done in the Prasad Institute of Medical Sciences in June 2024. This is a case of infected implant, the PFN, which was done for intertrochanteric fracture. The implant was removed. This is a case of fracture shaft humerus left with fractured intra-articular distal radius left. The shaft humerus was closed, reduced, and retained by the tense nails, and the distal radius was reduced by a distractor and retained by cross K wires. This 26-year-old female had multiple fractures due to fall of a heavy object on the right foot. The multiple fractures were closed, reduced, and fixed by K wires. This 50-year-old male had an abduction type of bimalleolar Pott's fracture on the left ankle. The fibula was reduced first and plated. The syndesmosis between fibula and tibia was fixed by a syndesmotic screw, and the malleolus was reduced and fixed by cannulated cancellous screws. The 60-year-old female presented with 1.5 months old fracture neck of femur, which was transcervical, Powell's angle was 70 degree, Gardner stage was 3. She was treated by hemi-replacement arthroplasty. The operation was recorded and is available on the YouTube. This 44-year-old male, a case of fractured supracondylar distal femur, 15 days old, was treated by open reduction and fixation by tense nail. This 13-year-old male with fractured shaft femur left was treated by closed reduction and internal fixation by TENS. This 28-year-old male with the undisplaced fracture both bone leg was treated by above knee plaster cast and was discharged the same day. This 29-year-old female with a fracture patella treated by tension band wiring elsewhere had a problem with the implant, so the implant was removed. This 23-year-old male had an injury of the left knee 1 year back, for which ACL reconstruction was done. Post-operatively, there was infection and synovitis, so we did an arthroscopic synovectomy. The drain was removed on the third post-operative day, and the wound has healed by primary intention. There is a significant improvement in weight bearing and range of movement. This 9-year-old male presented with a gluteal abscess left side, which was drained by Hilton's method. The spiral fracture of the tibia and the fibula was sustained due to fall from bike 2 days back. We opened, reduced it, and fixed it by tense nail. This 60-year-old female with synovial osteochondromatosis was treated by synovectomy. This 12-year-old female with the 18 days old fracture medial epicondyle left humerus was treated by medial epicondylectomy. The 6-year-old male child with fracture both bone forearm 8 days old was treated by closed reduction and immobilization by tense nails. This 30-year-old female with fracture intertrochanteric femur right was treated by closed reduction on a fracture table and fixation by external fixator. This 40-year-old female with a fractured shaft of humerus left was treated by closed reduction and immobilization by TENS. This 32-year-old male with myositis ossificans in the triceps and the brachialis was treated by manipulation under brachial block, and the elbow was brought into functional position. This 32 years old male with a 13 days old fractured dislocation of the right elbow without neurological deficit was treated by open reduction of the dislocation and internal fixation by the K wires. This 52-year-old male with an intertrochanteric fracture left 2 days back was treated by closed reduction and retention by external fixator. This 35-year-old male sustained injury due to fall of a heavy object 8 days back. The patient was a case of intra-articular fracture proximal tibia, was treated by compression raft screw. This 25-year-old male with a 1-month-old fracture of the calcaneum in the talus with avascular necrosis of the talus was treated by excision of the body of talus and Blair fusion. This 38-year-old male with a recurring desmoid tumor on the anterolateral aspect of the right knee was treated by wide excision. This 45-year-old female with an intra-articular fracture lower end of radius and fracture pelvis was treated by reduction by distractor and fixation by cross K wires. The fracture pelvis was treated by bilateral below knee balance skin traction. This 20-year-old female with multiple fractures due to crushing of the left hand and wrist was treated by closed reduction and immobilization by K wires. The inferior radioulnar joint dislocation was reduced and stabilized by cross K wire. This 8-year-old male with a fractured supracondylar left humerus was treated by reductions, setting, and immobilization by K wires. This 30-year-old female with intra-articular displaced fracture of the proximal tibia was treated by reduction by the rafts, compression screw, and another screw to prevent rotational instability. This 50-year-old male with a fractured proximal humerus was treated by closed reduction and fixation by cross K wires, and his fracture both bone leg on the right side was treated by closed reduction and immobilization by cross K wires. This 30-year-old male with osteochondromatosis of the right knee with lateral meniscal injury was treated by arthroscopic synovectomy and balancing of the lateral meniscus. 3 osteochondromata were removed. This 45-year-old male with intertrochanteric fracture was treated by closed reduction and immobilization by external fixator. This 68-year-old female with a fractured shaft of humerus was treated by open reduction and internal fixation by TENS.